I want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction about how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey, welcome to Keeping It 100. I thought I was muted. I am not muted, so let me clear my voice over here. Welcome to the show, everybody. We are so excited to be here. As always, we are here to have these open and honest conversations and make sure you have exactly what you need to make a health decisions. I am your host, Dr. Kristin Motley, and I am joined by Dr. Tanya Thomas in the background. She's going to make sure that all your questions are answered. So please let us know y'all watching. Give us some likes, give us some claps, something, and make sure you ask questions because we're here for you to make sure that your questions are answered. So put her to work, y'all. Put her to work. All right, let's bring in my wonderful co-host, the street practitioner himself, Georgie Mink Jr. Uh-oh. Let me bring him in. There you go. Wait a minute.
There you go. What's going on, Doc? Good afternoon.
What up? How you living, G?
I'm good. It's the start of the summer. Well, not really the start, but the start.
It seems like it. This summer is going. It's like almost over July. I'm like, like this summer is moving. I really am starting to think that there is some speeding up of time or something that we have not been told about, because time do not need to be flying like this.
Nah, I just think because you're so busy, Doc. When we busy, you're just waiting for the next day. I mean, I always say, though, once July 4th hit, the summer's over. So it's downhill after that.
I am really feeling that now. But we have been busy. We've been in these streets. So let me just start from the beginning, because y'all want to know why I think time flying. We're going to start all the way back. I don't think we show any of these pictures yet, so we definitely about to catch y'all up. But we were out at doing some COVID and some monkeypox vaccines out in Upper Darby at their Pride event. That was amazing. We was out there having a good time, really in the groove of things. And then after that, we did a community baby shower. This is George and Thomas. I think this is a community baby shower. I don't even know. It was just a lot going on over the last couple of weeks.
That's the baby shower. The table looked good too.
And we know who did the table. That's why we know we're looking good. We know who did the table.
I get the table credit.
I spoke at a sustainability conference, and so those are my panelists. That was a good event at Widener. That was a few weeks ago. Here go G at work setting up a table. This was at the Brother to Brother event in Chester with Local 413. Shout out to James Harper and Mark Freeman. They put on an amazing event for men. So if you didn't go this year, make sure you go next year. I'm proud of my dad. He went. I told him about it, and he remembered, and he went, and he really enjoyed himself. So we had our nurse there. Rashid was there taking blood pressures, and so that was amazing. And let me see, what's this? This is the Tie on One event again with Local 413 down at the waterfront, Juneteenth weekend. And we was just busy. I think the event that surprised me the most was Juneteenth in media. Shout out to the County of Delaware. The County of Delaware showed up and showed out. Everybody came out. It was an amazing event. The vibe. It was a whole vibe.
It was, Doc. We was even on TV. We got interviewed by ABC.
Yeah, that was cool.
Put them pics up, but
I forgot.
It's okay.
I'm struggling with these ones.
It's okay.
No, we had a good time. It was a whole vibe. So definitely, if you didn't make it to Juneteenth out at Rose Tree Park, that was sponsored by Delaware County, definitely come next year, because it was a whole vibe. I can't even explain it, but it was amazing. So we've been busy, so maybe that's why I feel like time is speeding up, because it was a lot that weekend. But I'm glad, I think I told you that I had a cavity. Yeah. I ain't never had no cavity, so I'm sorry, but I never had a cavity before. and I got a cavity, and my appointment to get my cavity filled was yesterday, and I had canceled it. I'm
Oh,
scared. I am so scared. I cannot
oh, come
imagine
on, Doc.
somebody putting a needle in my mouth. Like that don't even seem like something that I want to do. So I had called them on Monday and was like, "Yeah, I'm not going to make it." And they said, "You want to reschedule?" And I said, "I'm gonna call back and reschedule it." So I gotta get my life together. I mean, I do want to get a feel. I want to take care of my teeth. I don't be walking around like yuck mouth, but I just can't get over a person coming at my face with a needle. That just, I don't know. How
Doc,
you get through it, G? How you
we
get
got
through
to
it?
get better, Doc.
Help me. I need some
Come on.
help.
I mean, that's what I love about our show. I mean, we really keep it 100.
We do.
They canceled the appointment though. You heard me.
At least they can't call me a no-show. They ain't gonna call me a no-show.
The doctor canceled the appointment. So that's
Ah,
we definitely keeping it 100 today. It's all right. We
always.
definitely got to get in there before you add on a twin. Okay,
You right.
we don't want to have a twin in there. All right.
You
So you
right.
got it from somewhere. Let's go. And my blood pressure
Ah.
was great. I got it checked yesterday.
Oh, what was it? Tell me your numbers. I need numbers.
120. I forgot the bottom number. It was great though. Like
Oh,
I'm gonna
okay.
start writing it. I'm gonna
Woo.
write it down next time. I'm getting
Write
better
it
at learning
down.
these numbers, but it was a great reading. So
I'm glad to
I
hear that.
changed some things. I've been going to the track. I
Okay.
actually didn't start the gym, but I've been going to the track. I
Listen,
gotta put the
that's
gym
it.
time in between my schedules or whatever. But I definitely started the track, and I definitely been watching my diet, and I cut out like all sugars at this point. So I'm just going hardcore for 30 days, and that's pretty much the mission. So
Okay.
I'm not
Can
just
I offer something?
fire. I'm actually in the movement.
I love it. I
What
love
you
it.
got to say? What you got to say?
Can I offer something?
Go ahead. Go
I
ahead.
just want to say that I am incredibly proud of you. You are going to the track, and the track is enough. You don't have to go to the gym.
Mm-hmm,
So the track is enough. It's about us doing more than what we were doing. So if you
mm-hmm.
just want to walk around the track a couple times, take a couple jogs, or just walking, doing something more that you hadn't been doing before is enough. So don't feel too pressured to go to the gym. The one thing I would say is cutting out the sugar is extreme, and you got to be careful of making extreme changes because extreme changes come back when like the results come back as soon as you stop. So if
Mm-hmm.
you're not willing to give up sugar for the rest of your life, I wouldn't do it. I wouldn't give up sugar at all. I would,
Okay.
cut back on it, but don't cut it out because it's very extreme. And when you start to consume sugar again, you're just going to go backwards and you're just going to pick the weight back up. It's a temporary fix. Like to diet is temporary. What you want
Right.
to do is change your lifestyle.
That's true.
So I would just say cut back on sugar if you want or
Okay.
not. Like you got to do what feels comfortable, what you're going to be able to do for the rest of your life.
Right.
The trick is do it for the rest of your life, not just real quick.
Right.
All
Oh, that's
right.
great
So
advice. The doc
I
says. I
got
like that.
you.
That was a
I
doc
got
says
you.
moment. Okay.
I ain't gonna let you like
No, I
fail.
like
I'm
that
not
though,
gonna
because
let
you're
you
right though,
fail.
doc. It's not we do the quick fixes and I'm gonna do this and I'm gonna stop eating fried food, but it's a gradual thing and it's a lifestyle change. So it's not just for because I'm getting ready for the cruise. But
Yeah, yes. Get
but
ready
you're
for the
right, doc,
cruise.
doc. It's a lifestyle
It's
change.
forever.
Right, right, right.
I
So
got you. I
great
got you.
advice, great advice, great
Oh,
advice.
thank you. I try out here. But real quick, let's hop over to the news real quick. The FDA came out with a new announcement that they're going to have a new COVID vaccine in the fall. It will just primarily to focus on Omicron. So everybody stay tuned for that. We will be out in the streets during our clinics. We're probably not going to do many more now because the new one is coming out in about 2 months or so. So just hold tight. We'll be back. And when we out, y'all invited to come and get your new Omicron vaccine to protect you for whatever is in circulation there. I'm going to be 100. I'm gonna get it if it shows that cases are going up, people are back in the hospital, protection is starting to fade. I'm gonna get it. But if protection isn't fading, people not winding up in the hospital who had already been vaccinated, I don't know if I'm gonna get it. So I'm gonna just see what the data tells us and make my decision from there. So that's how I feel. G, how you feel?
I feel the same way. I mean,
Okay.
that's good advice. I mean, you don't have to be so rushy. Like that's why
I
I don't
want to look
really
at.
find people that's reluctant or hesitant or whatever. Do your homework. I mean, it's still going to be a new vaccination. Give it some time. You already boosted, so you have some type of protection, and still take precautions, like with the
Yeah, always.
sanitizer, washing your hands. You a big mass person in certain situations, so still follow those. That to me, those things are more important than just the vaccination. Like the
Yeah.
vaccination is just one defense against it, but like the everyday things that we could be doing, they the things that you were supposed to implement in your lifestyle to avoid catching COVID or any other diseases for that matter. So
Yep.
yeah.
Yep. So y'all stay tuned for that. I seen something in the news about the US approved lab grown meat. And I was like, that's interesting. Have you heard about that?
No, ma'am.
I know you'd be watching the news.
Right, but I didn't hear that.
So the
So
US
could you
approved
explain?
lab grown meat. So what they're doing is they're taking the cells from a chicken, growing it, and creating the meat out of that, as opposed to raising the live chicken, killing the chicken, and everything that goes along with that. I don't eat meat, although I started eating chicken on Saturdays because it'd be easy to stop at Chick-fil-A to get a chicken sandwich when I be hungry. But I haven't eaten meat for years, and I just started eating Chick-fil-A sandwiches on Saturday. So, but other than that, I don't know about lab grown meat, and I got to read more about it. But it is a thing, and I saw that the only other country that does it is Singapore, and I'm not sure we want to be following in the footsteps of Singapore. I've never been to Singapore. Shout out to Singapore, but I kind of feel like if a European country was doing it, or Canada, but we're gonna keep an eye on lab grown meat.
Yeah.
I don't know. I don't know.
Yeah, I
All
don't think
right.
I'm buying a ticket, but go ahead.
June, as everybody knows, is Men's Health Month. The last week of June, so y'all know every week this month we have had on a male healthcare provider to educate us on different topics, and so this week is no different. So let's bring in Dr. Kristin. He is here to talk to us about testosterone. Hey, Dr. Kristin, I'm gonna do your introduction, and we're gonna go right at it. He is the founder of Ether Medicine, a medical practice that focuses on delivering comprehensive and patient-centered care that addresses the underlying causes of pain and disease. In his practice, he takes an integrative approach, prioritizing patient education and collaboration to develop customized treatment plans. He is board certified. He is trained at Johns Hopkins, Harvard, all the top schools in the country. He is the man. Okay, so this is top flight security over here. This ain't just anybody coming up off the street. So Dr. Kristin, thank you so much for being here. Welcome to Keeping It 100.
Good afternoon, Doc.
Yeah, thank you so much. Thanks, Kristin, for the introduction. Thanks, Georgie, for being here, for the work you guys do, and excited to be here to provide education and help optimize life. Health.
Yes. Life, health, all of it. So today we're talking about testosterone. As I mentioned, June is Men's Health Month, and so we wanted to talk about topics that are important to men. And I know testosterone comes up for a number of reasons for men. So we're going to break it down a little bit, and can you just start us off by explaining what is the role of testosterone in the male species?
Yes, so that's a great question. And testosterone plays a huge role. I'm sure most people here have heard of testosterone being something that potentially relates to sex or being a male. But testosterone is this hormone that is really important for overall health, especially in men. It has specific function. And in fact, women also uses testosterone to do multiple things. So for men, a simple way to kind of understand what testosterone do for our body include thinking about sexual health, so sexual libido and erection. All of that is connected to testosterone levels. We also think about testosterone in the context of sexual development. So if you have a son, and a good way to kind of understand what testosterone is doing is when they go through puberty, what's happening? They have increased muscle mass. That's testosterone. They have enlargement in their penis, their scrotum, all of those things we call secondary male characteristics. Even facial hair is a function of testosterone. And then in addition, also even the deepening of the voice is all a function of testosterone. We can also think about testosterone in a role of reproductive function. So how you make babies, sperm, all of that is related to that. Muscle and bone health also relates to testosterone. Cognitive function, being able to have clarity mentally and physically and to be able to perform, is a function of testosterone. And then also cardiovascular health, your heart health is also something that testosterone play a role. So it's this particular hormone that goes beyond just being a male to improving our physical, psychological, and overall well-being.
Wow.
That's a lot. I have a question, and it may embarrass my son later, but because right now I'm changing his his diapers. What age will he be going through puberty? Is like 9 to 13? Is it still the same age? Because these kids are like advancing quicker than usual. Do you have any idea, like what age should I be expecting?
Yeah, so that age, exactly. So that age actually keep changing, because it used to be, you have to hit like 12, 13, 14 before men started having some of these puberty things. But it happens a little bit younger in some people. So even 9, 10 years old, some males will start developing that. But ideally, between 12 and up, that's when some of this secondary characteristics start showing up. And it's a function of multiple things. Sometimes we have this other things in the environment that disrupt even how hormones are made. We believe some of those things is playing a role in this kid becoming mature too quick. But normally that's the age that this is happening.
Could it be the hormones in chicken and in other livestock that we eat? And what do you think about the lab-grown chicken now that we mentioned hormones in our food? So I'm going to pull you into this.
Yeah, so that's a great question. And I think there's something called endocrine disruptors. So there's this specific toxins or things in the environment that actually disrupt how our body make hormones, testosterone being one of them. Thyroid, there's other hormones that we make. And we know that like plastic, other specific toxins, but in terms of antibiotics-based animals and those things, I'm not aware of any specific literature that links the two. But again, we know that some of those activities can be considered endocrine disruptors. So I don't think we have enough to make that conclusion yet. But as you were talking about earlier, we're growing meat in the lab. And again, it becomes a function of, how do we make sure that this is really safe? We don't have enough to really make the case at this point. Yeah.
Thank you. So miss me with the lab-grown chicken.
Right.
I need restaurants to have signs on their door. Lab-grown chicken served here. Like I need the FDA to put that out. Like you need to tell people if the chicken is coming from a chicken or a chicken. Like what I'm eating.
Absolutely.
So
absolutely.
Let us know.
So Dr. Kristin, when we talked about like the early stages, like when you start to develop. So when we're going backwards and we're going to the end. So when should men start to worry, like, or start to feel like, or when do the testosterone levels decrease? Like at what age, or like what factor does that play or whatever?
Yeah, so that's a great question. And I think it helps to kind of think of it two ways. One is really understanding specific, as I talked about, specific things that testosterone allows you to do, right? So ideally, when we look at age, when we turn close to 41, that's, after 41, every year after that, your testosterone levels go down about 1% every year after that, okay? Mm-hmm. And that rate of decrement or testosterone going down is a function of your health. Specific habits will actually make that go down a little bit faster. There's even people who are in young age, early 30s, that are having symptoms of low testosterone. And a good way to kind of think about this is some of those signs, which includes low libido, having low sex drive, having some issues with erection. It's not just the testosterone alone, but that can be the case. Having some fatigue, some cognitive deficits, not having the same energy, as you had before, or not being able to build muscles, because testosterone allows you to do all of those things. So when you notice that you're not having all of those things after age 40, this is when you have to really try to connect with a doctor to try to make a distinction, because sometimes some of those not having energy, feeling depressed, feeling irritable, not being able to make muscle mass, a lot of times that may relate to other medical things that you want to exclude. But ideally, after 40, that's when we start seeing testosterone down. The good thing is there's so many things that we can do to slow down that process.
Okay.
I want to pull up this question from Michael Long. He said he is 46, and his testosterone is 82. When he was 33, about 13 years ago, it was 76. His family doctor never explained how severe this was and just gave him an injection every 3 weeks. He couldn't feel any difference, so he didn't see the point in continuing, so he stopped. He said now his symptoms are more severe and he's about to start treatment at a men's clinic. Is this the normal process in terms of the age? And what do you think about his level? Like anything you want to comment on related to this question?
Yeah, so this is a bit unusual. So 33, most men should not be having this low of a testosterone. So in fact, when we consider testosterone less than 300 nano, there's a specific measurement that we do. Yeah. So if you have 83 at 33 years old, that's way abnormal. And this is where a good clinician is required to really look into what else is really driving this, because this is not normal, right? Mm-hmm. What else is going on? It's something that's blocking the stimulation of the testosterone to be made. Is something going on with your testes? Is something else that need to be ruled out, because this is not the norm. Because even men in their 80s, if they're healthy, they actually be able to maintain normal levels of testosterone. Even though you go down, people will be in the upper 500s, 900. So this is a little bit unusual. And I'm glad that this person is seeing a clinic that understand this process. So if a patient came to me and they were this low, I will have to figure out what else is going on. I have to get them to see endocrinologists, urologists, make sure that we're excluding everything else, right? If you came in and you're 100, and even if you had that much low of a testosterone, we still have to kind of investigate a little bit. But this is not normal.
Wow. Well, thanks, and I hope that Mr. Long finds the good practitioner and the help that he needs so he can feel better, because he did say that he is starting to have some symptoms now. Good question, and thanks for sharing your story with us. Now, you had mentioned there are some things that can be done to help maintain low testosterone levels if for people who have them drop. And I guess Mr. Long had mentioned injections. Can you talk about the treatment options that men have if they do have low testosterone levels?
Yeah, so it starts with first, and again, I like the question that he brought up, that they didn't explain to him why. Okay, so the level of testosterone alone doesn't explain the symptoms. You have to have low testosterone, plus you're having symptoms, you're having fatigue, you're having some erection issues, you're having some cognitive issues, you're losing muscle mass, you're not able to build as much. So you have to put all of those symptoms together with the level to say, okay, we need to do treatment. And then before you get into treatment, a lot of these things that goes wrong with overall health, making testosterone, is a function of specific health habits, okay? So potentially we have to investigate what is it that's driving this state of testosterone being low. For example, in your 40s, most men should not be having a lot of issues in your 40s with testosterone. We know that it's not going down. But if it's at a point where you're having symptoms, then we have to figure out what other things are driving that state. And a lot of times it becomes a function of sleep. Sleep is so important. You actually make testosterone when you're sleeping. So if men are not sleeping very well, if you're not sleeping very well because you're drinking alcohol, because you smoke, because you have other habits that implicate that process, that will implicate testosterone. And by addressing that, we can actually prevent you from going to treatment, specifically talking about the things everybody wants, the hormones replacement itself, right? Because that's not the solution. That's just like patching it. What is causing the problem at this point? Obviously, it gets to a point where people need it because they're having a lot of symptoms. But for most young people, the plan would be to dial in sleep, nutrition, certain food, and you were talking about, eating healthy food. Sugar is really bad for testosterone. Stress, cortisol levels. When you stress, you increase cortisol. For you to make testosterone, you have to take cholesterol, and then cholesterol has to convert into testosterone. But if you have stress, instead of making testosterone, the cholesterol becomes cortisol. So by managing your stress very well, that can help with that. Exercise. You actually make cholesterol, you make testosterone when you do strength training. So when you're using big muscles, the leg muscles, the back muscles, when you work on all of those things, you can increase your testosterone. So it becomes a function of kind of really teasing out what the underlying root causes of it and what can you do to prevent that or to address those issues before you go to the replacement. Because the problem is, yeah, we can provide replacement in the form of oral, like we don't recommend, oral intake, but topical cream, patches, injections. There's something called pellets that they can also put underneath the skin that gives you the testosterone directly. But a lot of times when you get to that place and you replace testosterone, the body doesn't make it as much anymore because it's a loop. It comes from the brain. There's a stimulation from the brain and it goes to the testes and you make all of these things. And when you're replacing the end product without really addressing underlying issues, people become dependent on it and people have to use this the rest of their life. And there is also some potential side effects that we have to worry about. So from my standpoint, it becomes many young people addressing some things. Sometimes they're not sleeping. We get them to sleep, we get them to the gym. All of a sudden, they're starting to make their own testosterone and feeling better. So I think that is very fundamental in getting people to address this problem.
Wow.
I love integrative medicine trained physicians because y'all get to the root of it. It is not just, oh, you got low testosterone, here's a testosterone injection, and that's going to bring it back up. No, you was like, we want to start at the bottom. Like, what's causing the problem? I'm going to send you to these specialists. Let's get to the root of it. You fix the root problem, and that could potentially fix the testosterone problem, and you won't need to worry about injections. Like, that is what I love about integrative medicine practitioners. So thank you for bringing all that training and all that knowledge and just really providing that comprehensive care that you include in your bio. I see you, Doctor.
Yeah, and also sometimes even just medication, specific medicines like chronic opioid use can actually disrupt how you make testosterone. So there's multiple things out there that we have to be careful with. And a lot of times we can, by changing some lifestyle things, we can improve all of those things.
Mm-hmm. You had mentioned drinking and smoking. Do they have direct impact on testosterone, or is it just a sleep disruption?
So, there's a way to kind of think about it. So when we drink alcohol, especially alcohol at nighttime, we know that alcohol currently is bad for everything. But when you drink alcohol, what it does is it helps you to fall asleep, right? People will drink before they go to bed. You pass out. But we all know that when you drink so much, you pass out, but then you wake up in the morning and you have a headache and you don't feel good and you're just not rested, right? So what alcohol does is alcohol, even though it sedates you and it makes you fall asleep, when it's breaking down in your body, the metabolites, it's actually stimulating. So it will help you fall asleep, but then as it breaks down in your body, it's actually waking you up. So you're not in deep sleep. And you make testosterone, you make all these cofactors or antioxidants, all these supplements that people are taking, your body actually makes it. You make collagen, you make all of these things when you can get into deep sleep, stage 4 sleep, REM sleep, right? So all of that become dysregulated when we are using alcohol, right? So that by default, you don't make those things and that can implicate your health. Same thing with tobacco and nicotine, right? So nicotine is a stimulant. It can also disrupt sleep and it also has impact on cardiovascular health, the vessels, right? So because when we're talking about your body making testosterone, it comes from the brain. There's a stimulation. There's a place in the brain, the hypothalamus, stimulates a signal. That signal goes into the testis to make testosterone. What is taking the signal down to the testis to make it is your vessels. So if you're smoking and you have atherosclerosis or a disease of the cell, of the vessel, that information doesn't get there as well. So we know that all of those things have to be put in place to address it. And as it turns out, exercise will help address the vessel. Exercise will help with sleep. And all of this other healthy habit, eating the right nutrition, will help prevent inflammation in the vessels to kind of help address all of these problems.
Wow. Oof. So, Dr. Kristin, what about some foods or things that we can, do to increase it or keep it at a certain level?
Yeah, so healthy nutrition. So I think maybe some of the stuff you've talked about, making sure we got enough vegetables in, we got enough good fiber in our body. And then there's also specific, vitamins. So vitamin D is very important in making testosterone. Magnesium, zinc. These are all things that is required to actually make that hormone, and cholesterol. So We need healthy fats, avocado, olive oil, fish, salmon. All of those things are very good for helping with how we make healthy testosterone. And then also, like I talk about vegetables, they've actually done studies where they had individuals, young men, eat like plant-based meals before they went to bed, and then people who ate like meat went to bed, and then they kind of measure the size of their erections at bedtime. And there's a huge difference in people who ate things that were not so inflammatory in nature. So we know that food plays a huge role in terms of how we make this particular hormones. And again, it's everything we put in our body, using it to create the things that we need. So those are things that I would recommend for people to kind of check into to help with that, and backing away from the fried food and the other things that cause inflammation.
Wow.
I got about 10 more topics. I'm gonna need you to come on and talk about, Dr. Kristin, because you was just like spitting it today. Awesome. Wow. So I guess let's talk about the sexual health component of testosterone, because I know that men start to care about it more when their performance isn't where it used to be. So what's happening there with the testosterone, and what are the recommendations that you would give to help men in that particular area?
Yeah, so that's a great question, because I mean, as men, we do care about that, right? Once the erection is going down, you're not able to perform, it start kind of questioning your manhood, quote unquote. So we know that testosterone is involved in libido, kind of the desire to have sex. It's not just the desire, the pleasure from sex, the orgasm, all of that is coordinated by testosterone. So as testosterone levels go down, that can become implicated. But a lot of times the misconception is just that, right? It's not just testosterone, because we talk about testosterone kind of being involved in the aspect of the desire, the stimulation, and all of those things. And one of the things that can also play a role in terms of sexual interaction is vascular health, right? So a lot of the times it's not just because your testosterone is low that you can't get an erection. For an erection to happen, we have to send blood into the penis to enlarge it and to hold it there. And that is a function of the vascular system. So we have to make sure that cardiovascular health is good. And we even know that when people start having erection problems that relates to vascular issues, that actually predisposes them to cardiovascular disease or heart disease. So it's important to not just think about, why am I having low erections? It could just be that your testosterone is low. It could just be that you're drinking too much alcohol. It could just be that you're smoking too much, or you're not sleeping. And then sometimes we also have psychogenic issues where, depending on what type of relationship you have, if you're having a relationship where you're not happy in that state, that can even implicate the ability for you to have healthy erections. So I think it's important to really put all of those things together to really understand what is driving this state. But we know for sure once testosterone goes down, that drive for sex also goes down.
Wow.
Yeah.
Can like the testosterone issues be passed on from your father, or is it hereditary?
No, so that's a great thing. So the great thing is it's not genetics. Okay, so that's a good thing. And there's some cases where there's something called androgen. When you make testosterone, it has to bind to this receptors called androgen receptors. And there could be other cases where there's some changes with those genes and people can have other problems. But really, the good thing is if your dad has low testosterone because of their habits, they're not going to be able to pass it on to you.
Okay.
And so that's a good thing. Yes. Yeah.
Okay.
Dr. Kristin got all the answers. Love it. G, did you have any other final questions? I just want to give you the last questions. Is men's health month.
I mean, just the thing, like the testosterone, what we can do to stay healthy. What is the actual levels for like a 40 or 45-year-old man? Like, what's the actual, like the number that, I guess is accepted or expected at that?
So that's a great question. And this is how I'll answer it. So there is a range, right? So we say, between, above 300 to 900 is normal. But what we also know that a lot of those labs is an average of a population. So some people can be even at a 900 and they're having symptoms of low testosterone. They can't function as well. So we don't treat so much the number, we treat the number plus the symptoms. So a number, ideally, you want to be above 500. So, a 40-year-old gentleman should be able to have something about 400. If you about 500, right? But if you have about 500 and you're still having symptoms, you may need treatment. And there may be people who even have like 300 and they are functioning at a normal range. So it's important to kind of combine what that number is and then also tying that up to specific symptoms. And I think, the last thing I want to even say to all of this is really everything we've talked about, it's all about getting your body to be healthy, right? If you want to improve testosterone, we have to talk about sleep. We have to talk about exercise. We have to talk about nutrition. We have to dial in stress management. If we can do all of those things, not only is your testosterone going to get better, your cardiovascular health is going to get better. You're going to be able to lose weight. You're going to be able to feel better. So this is all connected one system, and it's important that that message get across to everybody who's listening to this.
Wow. Good stuff.
We're going to go ahead and drop the mic and close out on that. Dr. Kristin, we are definitely going to have you back. You had spit so much and you know so much about so much. So we're going to need you back like once a quarter. So I'm going to go ahead and contact your assistant and get you booked on the schedule because this was really, really good. Thank you. Well, thanks for coming on and
thank you, Dr. Kristin.
Thank you guys for having me. Yes.
Yeah. All right, G. So we don't have anything else planned coming up. We don't have any events coming up, which is odd, but I'm taking it because I'm like, man, after Juneteenth, I ain't coming back till after Labor Day.
No, you didn't say that.
So I'm all good, but we want to remind everybody COVID is still out there. It ain't going nowhere. So please remember, stay protected. There is a new vaccine becoming available this fall. The FDA announced it recently. So just stay up to date on that and make sure y'all tune into Keeping It 100 right here every Wednesday at 12:15. We're going to drop a bonus show for Men's Health Month on Friday. So stay tuned for that and check that out and let us know what you think. Everybody have a good day.
Have a good one, Doc. All right, everybody. Have a good one.
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100 because that's what we do. All right.
Hey, Doc, you good?
Yeah, I'm good. Thanks, G.
So we got a bonus show on Friday, you said?
I'm gonna play the colonoscopy show.
Okay.
It's already recorded.
Nice.
See you guys next time. Have a good one.
All right.
Bye, guys.
Bye.
All right, Doc. I'm gonna hit the streets. I do gotta still submit my signatures from last week. I'll do that probably
please do that.
by 6, and then I did get the payment this morning. So.
Yep, and I get paid Friday, so you'll be good.
All right. Cool.
So you good? As long as I got some money, you got.
I know, Doc. We good. We keeping it moving.
You know what? Nobody ever ended this.
You're gonna have to cut it off.
Yeah. So you good?
Okay. All right, Doc.